www.ashrafulaid.org. Ashraful Aid, with humanity, for humanity.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Sunnah a Day, treat guests in your home with courtesy and respect.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Imagine this. You're putting together a 7-color meal, from the creamy pasta to the glazed carrots and flavorful onion gravy. This entire meal is made with our 100% pure extra virgin olive oil from our La Familia range, bringing outstanding quality and taste to your kitchen. Shop La Familia 100% pure extra virgin olive oil at any leading supermarkets near you. La Familia, heart of the home.
The views and opinions expressed by the guest and presenters of Radio Al Ansar are not necessarily the views and opinions of Radio Al Ansar and the Al Ansar Foundation.
Radio Al Ansar. Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to the Medical Files, brought to you by the Islamic Medical Association, your weekly health segment where we go beyond the headlines and dive into the health issues that truly matter to you and your loved ones. We're broadcasting live tonight from our Durban studios on Radio Al Ansar, and we also welcome the listeners of Radio Islam, Channel Islam, IFM, Voice of the Cape, Sirius FM and Radio 786. I'm your host tonight, Dr. Zakaria Ahmed Ismail. I'm a medical officer based here in Durban, and I invite you to stay with us for the next hour as we talk about a topic that touches almost every household. Yet it's so often brushed aside as just snoring. Yes, that's right. Tonight we're talking and we're shining the spotlight on sleep apnea and its consequences. Now let me ask you this. How many of you have been told by a spouse that your snoring is so loud that it shakes the walls, and simply just laughed off or brushed off? How many of you struggle to breathe through your nose at night and just assume that's just how you're built? How many families have watched a loved one fall asleep at the wheel, fall asleep in a meeting or even during a conversation, and wondered if something more serious was going on? And how many of us realize that the root of the problem may not be in the lungs or the brain at all, but sometimes it's the very airway that we use to breathe, in our nose and throat? Well, the truth is, sleep apnea is far more than a noisy inconvenience. It's a real medical condition, very often rooted in the structure of the nose, the throat, and the airway, as I said. In fact, it can affect your heart, your mood, your memory, and your safety on the road. Yet because it happens while we're asleep, it remains one of the most underdiagnosed conditions we see. So tonight we're going to pull back the curtain on sleep apnea from an ENT perspective, what's happening in the airway, why it happens, how it's assessed, and what surgical and non-surgical options exist today. We'll ask the questions you may have never thought to ask, and we'll give you the answers that could quite literally help you or someone you love sleep and live better. And joining us for this important conversation is our esteemed guest, Dr. Mohammed Thandar, an ENT surgeon who has helped countless patients identify their causes of their sleep apnea and guided them towards the right treatment, whether it was surgery or otherwise. Welcome to Medical Files, Dr. Thandar, and thank you for being with us tonight.
Shukran, Zakaria. I really appreciate your invitation. It's lovely to be back here.
That's good. So listeners, remember, this is your show too. If you have questions, thoughts or personal experiences you'd like to share, send us your WhatsApp messages on 060-904-1056. That's 060-904-1056. Don't wait for tomorrow. Don't wait until it's too late. Tonight is your chance to learn, to ask and take control of your health. So stay tuned as we explore what sleep apnea is, what role the airways in the nose and throat play, how it's assessed, and what treatment options are available today. But before we dive in, just to highlight one of our many projects under the Islamic Medical Association, and that's the renal dialysis project that continues to provide life-saving dialysis support to patients in need across our community. In fact, there's a few units around the country that's all accredited. We have 60,833 dialysis treatments across South Africa, with an average of 2,322 dialysis sessions per month. So your membership counts. If you'd like to learn more about how you can assist or contribute, please reach out to IMASA directly. But this is Medical Files, and tonight we're choosing awareness over exhaustion and action over another restless night. So, Dr. Thandar, before we start, let's start with the basics. From your point of view as an ENT surgeon, what exactly is sleep apnea, and where in the airway does this problem usually begin?
Okay, thanks, Zakaria. Bismillahirrahmanirrahim. So obstructive sleep apnea is what we're talking about. And essentially, it implies there is obstruction to the flow of air while one is asleep. And this, together with other factors like daytime tiredness, gives us the diagnosis or the definition of obstructive sleep apnea syndrome. So sleep apnea itself is part of a spectrum of disease, and the most common and mildest presentation is snoring. Okay, but snoring alone is one end of the spectrum of what we term sleep disordered breathing.
Okay.
And the other end of the spectrum, the more severe end, is obstructive sleep apnea. And then in between you have various presentations which we may term upper airway resistance syndrome. But the most important thing is that if a person is snoring, one needs to keep in mind that, and exclude sleep apnea, especially if there are other associated features, because snoring alone is not a major concern. It's a bit of a nuisance to the sleeping partner, but sleep apnea syndrome is certainly a very serious condition with very serious consequences if left untreated, and a very treatable condition as well in many instances.
So which specific structures then do we look at when we trying to assess someone for sleep apnea? So you mentioned upper airway resistance. So which structures are those?
So the upper airways start at the nose, and they end at the sort of the throat level, the windpipe level, or the voice box level, right? And then the structures that we look at, in that region are the regions where there's narrowing or obstruction to the flow of air. It would lead to problems. So this includes the nose, and in the nose we look at the nasal septum, the turbinates, and then the back of the nose we may have growths or masses there, like the adenoids in children. And then we look at the palate. In the oral cavity we look at the palate. We look at the tongue, especially the back of the tongue. We call it the base of the tongue. We look at the tonsils, the size of the tonsils. And then you look at the what we call the pharyngeal walls. Okay, those are the walls of the throat region that also tend to become very floppy and collapse when there's associated narrowing. And that's often what leads to the sleep apnea, the actual obstruction. So what apnea implies, the term apnea means that there's no breathing. Okay, you're not breathing, or there's no flow of air, despite efforts to breathe. So when one is sleeping, you may find, or somebody may witness this, especially the sleeping partner, the husband or the wife, may pick up that the individual is trying to breathe, making the efforts of breathing, but there's no flow of air. There's no air getting in. And that's the actual apneic episode, the obstructive apneic episode. And those are the serious episodes. Whereas with snoring alone, there's still flow of air. So primary snoring, or the least severe form of sleep disordered breathing, primary snoring, is where there's narrowing of the airway, but air is still flowing. The person is still getting enough oxygen. The oxygen levels are not falling. But when that becomes severe and you get complete obstruction due to multiple reasons which we're going to discuss, then that leads to absence of the flow of air. That's going to lead to low oxygen levels, and that's what has the consequences, the metabolic consequences, and you've already mentioned a few consequences, and we'll discuss that as well.
So the classic signs or symptoms then, was that someone or a partner that may witness these symptoms is seeing their partner trying to breathe, trying to get air in, but there's no flow of air. And as you mentioned, then snoring on the other end of the spectrum is still flow of air, but it's turbulent. That's where the noise
Correct.
comes from. Okay, so can enlarged tonsils or adenoids in adults also be a factor, not just in children?
Yes, they can be. It's not common because adenoids themselves or itself generally in the teenage years tend to regress. Okay, so most adults do not have adenoids. Okay, although the tonsils are still present, and certainly if they are very large, they do cause obstruction of the airway. So in children, it's most children with sleep apnea, obstructive sleep apnea, is due to enlarged adenoids and tonsils, and the treatment is very simple. You remove the adenoids and tonsils and you cure the problem. Unfortunately, adults is different. Although large tonsils can be a problem in adults, it's not common, or it's not common or enough to cause the sleep apnea syndrome in adults, because the airway itself is so much bigger, just from the physical size of the individual. Okay, but it's usually other factors, like we mentioned. Deviated nasal obstruction alone is not going to cause sleep apnea, but it certainly contributes to it. Most of the obstruction for sleep apnea comes in the back of the mouth area. Okay, what we call the pharynx. So it's the palate, it's the base of the tongue, it's the walls of the airway, the pharynx pharyngeal walls, right, with or without the large tonsils. That's where most obstruction comes in patients with sleep apnea. And that's where we'll discuss the different treatment options for these problems. You also have to treat nasal obstruction as well, because it contributes to the problem. It contributes to the effectiveness of treatment. So if somebody with sleep apnea has a severely deviated septum, has a blocked nose, has large turbinates, polyps, sinus, you got to treat that as part of the problem. But treating that alone is not going to cure the sleep apnea. You got to treat the actual primary areas, which is usually in the pharynx, back of the tongue, palate area.
And with children, why do we see that some of them have enlarged tonsils? How do they get enlarged tonsils?
Well, the tonsils are lymphatic tissue, right? And lymphatic tissue is the same sort of tissue you get in your lymph glands. And the function of this tissue is part of your immune system. It's to react in response to any foreign object, whether it's an infection, a viral, a bacterial infection, right? So children, as their immune systems are developing, they're very prone to infections. As you know, children, once they start going to school, they pick up a bug from somebody else and it spreads to the siblings. This is because the immune systems are still immature. But when they pick up these infections, their body reacts. And it reacts by swelling and inflammation of these structures. The adenoids is a lymphatic tissue at the back of the nose. Tonsil tissue is lymphatic tissue at the back of the mouth. So these are reaction to what you are breathing in, to foreign bodies, to bugs that's coming in through the nose and mouth. So this is what causes these structures to enlarge. And then sometimes when they enlarge, you also get infected. And when they get infected, they enlarge even more. Okay? But you can get large tonsils and adenoids without any history of tonsillitis or infection. Okay? But the effect is the same. When they become large enough, they narrow the airway, they affect the flow of air, and that can lead to snoring and then sleep apnea as well.
So would a child who has enlarged tonsils and adenoids, who is complicated with sleep apnea, would you offer, or would there be any alternative treatment aside from removing the tonsils? Are there any treatments options available?
If there are obvious, if the cause is an obvious enlargement of the adenoids and tonsils, then no. Okay, the treatment would be fairly straightforward with excellent results.
Yeah.
Okay, but if there's associated problems, especially nasal problems like allergic rhinitis, hay fever, with lots of swelling of the nose and mucus that's causing blockage, affecting the flow of air, causing nasal obstruction, then you would treat that. Okay, that you can treat with medication,
Right.
Nasal sprays, antihistamines, and improve the nasal airflow. But it's not going to cure your sleep apnea.
Right.
Okay.
It has to come
If a kid just has snoring, primary snoring, then yes, you may get improvement with the snoring by improving the blocked nose.
Right.
But if it's sleep apnea and you've got large adenoids and tonsils,
It's got to
then
come
it
out.
needs to come out.
Okay. How does jaw and chin structure influence airway collapse or sleep apnea?
Yeah, so it's basically about anatomy and position of the tongue itself. Okay, so when you have a receding, what we call rectonatia, small jaws, receding jaws, then the tongue, which also attaches via the musculature to this region, also sits further back. And it's the back of the tongue, when it makes contact with the back wall of the throat, that obstructs the airflow. Okay, so generally, even if a patient does not have a problem with their jaw, okay, you will notice that patients who snore a lot or have sleep apnea is worse when they are lying supine, when they're lying on their backs. Because when you lie on your back, by gravity, when you are asleep, when your muscles lose tone, that tongue is going to collapse. It's going to lose tone. It's going to fall back. It's going to close off the airway.
That already narrow space.
That's already in that narrow space, and that's going to lead to obstruction. So that's why with snoring, we always try and advise to rather sleep on your side or try and sleep a bit elevated. Okay, to try and counteract the effect of gravity. And obviously not easy. You can't do that automatically when you are asleep because you're not aware. But there are simple ways where we sometimes advise, like attaching like a tennis ball to your back.
Right.
So it's uncomfortable if you lie on your back, and then even in your sleep you'd rotate to the side. But there are special types of pillows that sort of will encourage you to be lying on your side. So there are ways that we can try and address that.
What are some of the risk factors of developing sleep apnea in adults?
Well,
so we hear a lot about obesity.
Obesity is probably the main risk factor. And what obesity leads to is often is fat deposition in the neck area. So that's why when we assess patients with sleep apnea, we often look at the neck circumference, because that fatty tissue is what actually puts weight on the muscles that keep your airway open. Okay, in your throat, in your neck region, and when these muscles lose tone, when we sleep, you go through these phases. You probably heard the terms of what's it? Come to me. The phases of sleep, right?
REM and non-REM.
REM and non-REM, right? Where you lose in your REM sleep, you lose muscle tone, and that causes even the muscles of the airway will tend to collapse. Now, if you've got an additional weight of fatty tissue pressing on that floppy muscle, is going to lead to further obstruction. So obesity is probably the main sort of factor to contribute to sleep apnea, and it's also something that if you address it, if you reduce your weight, and there are guidelines. We look at about a 10% reduction in your weight can lead to a 25% reduction in the severity of sleep apnea. Okay, we looked at your factors called your AHI, your apnea-hypopnea index, when we do sleep studies. And it's been well documented that patients who lose 10% of body weight you can actually reduce your AHI by 25%.
That's
so
significant.
It's quite significant, yeah. So managing obesity is a big part of managing obstructive sleep apnea.
What about some other lifestyle choices? So we've mentioned obesity, so that's your diet. What about smoking? Does that affect the airways specifically and cause sleep apnea?
Yes. So smoking can have multiple effects. One of the effects is that it causes irritation and inflammation and swelling within the airways. But smoke as well, and nicotine within smoke is also a muscle relaxant. So it can also relax your pharyngeal musculature. It also has other effects. It can relax your lower esophageal sphincter and contribute to more reflux during sleep, and reflux is often associated with sleep apnea as well. So reducing smoking or cessation of smoking would be one of the things we would recommend for managing sleep apnea, and the same with alcohol as well. Alcohol has more sedative effects and certainly affects the quality of sleep, and that's also very important. So we look at all these things: alcohol, sedative drugs, smoking. These are all factors that need to be addressed.
I think so. Now we've set the stage. We understand what sleep apnea is, and importantly, where in the nose and the throat the obstruction often begins. So you're listening to IMA Medical Files, and tonight we're talking about sleep apnea and its consequences with our special guest, Dr. Mohammed Thandar. We'll be back shortly after this ad break.
At Amina's Wonder Spice, we know that many of you already enjoy the pleasure of cooking with our 100% pure ginger and garlic. Our unique masala paste have created a new dimension and variety to your dishes. For all these reasons and more, we've called it a Wonder Spice. Amina's Wonder Spice, creating a unique taste in a paste. Available throughout South Africa, neighboring countries, and also in the UK. Contact us on 031 577 5023 or www.aminaspice.co.za.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio-visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickville Road, Overport. Simplex Radio, the name you can trust.
Assalamu alaikum wa rahmatullahi wa barakatuh. I am Bibi Aisha Lahir, presenter and producer of the shows Phenomenal Family and Cooking with Bibi Aisha. Behind every strong family is a woman whose love, strength and sacrifice often go unseen. This Women's Day, take time to celebrate you at Her Mask, Her Story. A beautiful day of inspiration, meaningful conversations, delicious food and cherished sisterhood. Tickets are just 300 Rand. Book your place today by calling Al Ansar Outreach on 031 208 1601. I look forward to sharing this special day with you, inshallah.
In South Africa, countless numbers of sick patients leave their homes at the crack of dawn to join long queues at clinics and public hospitals, many of them suffering pangs of hunger in addition to the symptoms of disease. The Al Imdad Foundation's Slice for Life teams deliver sandwiches to these patients at more than 40 hospitals and clinics across the country. Help us to keep on relieving hunger. Donate online at alimdad.com or call 0861 786 243 for more information.
Celebrate with flavor. Come visit the all-new Checkers Saxony Westwood. From cured meats, rich and savory, to spicy tandoori chicken, try our authentic Indian curries, perfectly seasoned and ready to serve. Everything is made fresh daily with care and quality you can taste. Our halal certified deli brings you freshness, flavor and variety worth coming back for. Whether you're setting the table for family or sharing something special on the go, discover the Checkers Saxony Westwood Deli, where good food is always on the menu. Checkers Saxony Westwood, butchery, bakery and deli, certified by the NIHT.
Feed your soul with knowledge. At the Al-Ansar shop, you'll find a wide selection of Qurans, Islamic books, children's literature, educational resources, gifts and inspirational reading material. Whether you're beginning your journey of learning or expanding your Islamic library, we have something for every age. Visit the Al-Ansar shop today. Al-Ansar shop, inspiring hearts through knowledge.
Radio Al-Ansar, 24/7, 365.
Welcome back. If you've just joined us, we are talking about sleep apnea and its consequences with our special guest, ENT surgeon Dr. Mohammed Thandar. This is the Medical Files. Before the break, we were talking about what sleep apnea is and where in the nose and the throat the obstruction begins. We do encourage your input, your questions. You can send us your WhatsApps on 060-904-1056. We do have a question that's come in. So listener says, husband's been diagnosed with sleep apnea, but just can't get used to the machine and mask. He frequently stops breathing at night, and once he's shaken, he breathes again. He's been told that he's at risk of a stroke as well. Any advice?
Yeah, thanks for that question. It's actually a very common finding. Okay. So exactly what she describes is that husband is having these apneic episodes, and she has to shake him up to sort of get him to breathe again. So what's happening in that episode is that there's no airflow, and he's apneic. But the thing is that just a quick sort of reassurance is that even if she does not sort of stimulate him to wake up, he will wake up. Okay, because what's happening during that episode is that his oxygen level is dropping, it's falling because he's not getting air. But when it falls to a certain level, by reflex, it's going to stimulate him to wake up. So the patient will often wake up with a gasp or a choke. Okay, he may not wake up fully, but he will awaken enough to start breathing again. Okay. So she can be reassured in that regard. But what she's also saying is that her husband he's been assessed and he's been put onto a CPAP machine. Now, CPAP is a form of treatment for obstructive sleep apnea. It's the letter CPAP, which stands for continuous positive airway pressure. So essentially, it's wearing a mask, and either a mask over the nose or over the nose and mouth. And this mask creates a flow of air. It's normal air. It's not oxygen, but it's the flow of air that actually acts as a stent. That means it prevents the airways from collapsing, prevents these floppy muscles and back of the tongue from actually collapsing and closing up the airway. Now, the thing with CPAP is that as her husband is experiencing it, it's not comfortable for a lot of patients. Although it's fairly effective, it's pretty effective, but because it's not comfortable, then there's non-compliance. So the patients don't use it. Okay. So, for CPAP, for CPAP to be effective, a patient has to be using it at least for 4 hours continuously at night, right? To try and prevent the consequences of obstructive sleep apnea, which is not a lot, 4 hours of sleep. But even that, many patients cannot tolerate it. Now, why don't they tolerate it? One is to wear a mask over the nose or the mouth can be uncomfortable. Two is that sensation of the flow of air can be uncomfortable. Okay, but there's generally about a 50 to 60% compliance rate. Okay, and maybe about a 40 to 50% of non-compliance, so patients are not going to use it. One can look at using different types of masks and see how, to try and get it more comfortable. Generally, the mask just over the nose is more comfortable than what we call the full face mask, the one over the nose or mouth. Some patients feel claustrophobic wearing the face mask, the full face mask. Okay. Then again, with CPAP, what it's trying to do is this flow of air has to be at a certain pressure. Okay, to overcome the obstruction, to overcome the blockage, you need a certain pressure. The more severe the blockage, to stent open the airway, right? The more severe the obstruction, the higher the pressure that's required. Okay, and the higher the pressure that's required, the less comfortable it's going to be.
Right.
Okay, so in this sort of instance, one has to look at what is causing the obstruction, what is causing the high pressure. Okay, now this is where things like looking at the nose comes into play. Okay, if you've got a very blocked nose, if you've got a severely deviated septum, if you've got large turbinates, you've got polyps in the nose, that's going to cause obstruction and require high pressures on your CPAP machine.
Right.
Okay, so by addressing that, okay, where the surgical management comes in, by straightening out the septum, reducing the size of the turbinates, reducing or removing nasal polyps, you improve the airflow within the nasal cavity, and it significantly reduces the resistance to airflow and the pressure that is required from the CPAP machine. So then the CPAP machine works at a lower pressure, is more comfortable. So that's where surgery and CPAP can go hand in hand. You know, often these patients need a combination of treatments to control the sleep apnea. So if one had to look at the actual treatment of sleep apnea in different categories, okay, one we discussed earlier, simple things: stop smoking, avoid alcohol, stop the sedative drugs, right? Second is management of obesity. Okay, and that's now a huge, lots of options, you know, with these newer drugs that have come out, with weight loss surgery, bariatric surgery. It's making dramatic improvement or potential for improvement in the management of sleep apnea, right? Then you look at devices that you can wear in the mouth. Okay, we call them mandibular advancement devices. Okay, we spoke about the position of the tongue and the position of the jaws, right? So you can wear devices in the mouth to bring the jaw forward, bring the tongue forward while you're sleeping. It's like a denture type of device. Custom made is the best ones, and they do work. Okay, so that's another branch of treatment. But then the main branches that come in is CPAP therapy and surgery. Okay, and not everyone is going to be a candidate for each one. But some patients may need even both. Okay, so it's very individualized.
It's a combination
treatment.
Usually.
Yeah, you got to look at each patient differently. Each patient is going to have different factors that are causing their sleep apnea, and then you got to address those factors.
Each one.
Okay, you can get sleep apnea in thin patients that are not overweight, that are not obese, and that's the treatment for that is very different from an obese patient. Okay, with a big neck, short stature, big tongue. You know, so that's a completely different type of patient that you're looking at. So it's a very individualized treatment.
So, untreated sleep apnea, what are some of the medical consequences and lifestyle impacts that
so very good question, because this is why we want to treat sleep apnea, is to prevent the consequences. And sleep apnea, it's a serious condition because of the serious consequences. Okay, so probably the most common consequence is poor sleep quality.
Right.
So you wake up tired. You're tired in the day. You fall off to sleep easily in the day. You have poor concentration. You have irritability. You have mood changes. This can also lead to things like depression and anxiety and things like that, right? But then there are more serious consequences. Just in terms of this daytime tiredness, people have even, as you mentioned, fallen asleep while driving. Okay, and you can have a serious accident in that way. So it has happened. Then there's the other consequences, which are largely like metabolic in nature. You can develop hypertension, diabetes. Okay. Now how does this happen? Okay. So when you're having these apneic episodes, your blood oxygen level is dropping. When that happens, the body automatically starts to produce hormones, right? Like what we call the catecholamines, adrenaline, noradrenaline. And if this is happening, your stress hormones, if it's happening repeatedly every night for months and for years, it's going to have consequences. And the consequences are hypertension, diabetes, other cardiovascular disease, arrhythmias, atrial fibrillation. Okay, and then things like strokes. I think she mentioned about on the question about her husband, so he could have a stroke. Yes, that is true. So these are the consequences. You can also develop very high pressure within the lungs because of this constant low oxygen levels. You get vasoconstriction, narrowing of the blood vessels in the lungs, and this can lead to what we call pulmonary hypertension. Okay, and that can lead to cardiac failure because the heart is pumping now against a very high pressure in the lungs. So these are life-threatening conditions as a consequence of untreated sleep apnea.
So it's a serious. It does have its serious complications.
It's also like poor. If patients are hypertensive, diabetic, especially hypertensive, if you've got poor control of your hypertension, patients are on 4 drugs to control their hypertension. One of the things to look at is, does this patient have obstructive sleep apnea contributing to this poor control? Okay, so it's a very diagnosed condition, underappreciated, even amongst medical specialists. You know, it's not well recognized as in terms of its the significant conditions that it can lead to,
and its contribution to cardiovascular
disease.
So there's many misconceptions out there. Now, some men believe that it's just how they're built. Nothing can be done surgically. What would you say to that?
No, so look, I mean, surgery has a big part to play in sleep apnea, but it has to be individualized treatments, and sometimes in combination with other treatments. So yes, you have to look at the anatomy of the patient. Okay, and if there are surgical options of managing and improving the airway, that can lead to significant improvement and control of sleep apnea. Okay.
So I think there's some really important clarifications there, Dr. Thandar. Sleep apnea is very often rooted in structure of the airway itself and the complications thereof. And understanding where the blockage occurs is key to choosing the right treatment. So after the break, we'll be talking more about sleep apnea and its consequences.
This segment is brought to you by Kenfield Auto, your RMI approved service and repair specialist. 236 Brickfield Road, Overport. Kenfield Auto.
Bismillahirrahmanirrahim. Rabbana zalamna anfusana wa in lam taghfir lana wa tarhamna lanakunanna minal khasirin.
Car won't start?
Kenfield Auto.
Noisy brakes?
Kenfield Auto.
Due for a service?
Kenfield Auto. Kenfield Auto, the answer to all your car problems. Your service and repair specialist for your VW, Audi, Suzuki, Toyota, or just about any vehicle. Kenfield Auto, your RMI and insurance approved workshop. Follow the red and white board in the passage at 236 Brickfield Road, Overport. Call Shafi on 031 207 2399. Kenfield Auto.
Radio Al-Ansar.
Assalamu alaikum and welcome back to the Medical Files, brought to you by the Islamic Medical Association of South Africa, your trusted guide to medical awareness and empowerment. I'm your host, Dr. Zakaria Ahmed Ismail. Today we're talking all about sleep apnea and its consequences. And joining us today we have our special guest, Dr. Mohammed Thandar, ENT surgeon. Now, before the break, we were talking a little bit about CPAP. We were talking about the risk factors. We were talking about some common misconceptions around sleep apnea. Now we're going to spend some time talking about assessment and the surgical options. So, Dr. Thandar, what does an ENT workup for sleep apnea look like? What does it involve?
Okay. Yes. So firstly, any patient with sleep apnea needs to have the airway assessed. Okay. It's often sometimes inappropriately prescribed treatment in the form of CPAP therapy. by many specialists that deal with sleep apnea without even having an assessment done by an ENT specialist. Because sometimes it could be a simple problem with a simple solution where, like, for example, very large tonsils, and if you remove that, you can often cure or reduce sleep apnea significantly, and not require CPAP therapy, for the rest of your life. Remember, CPAP therapy is it's something you have to use every day for it to work on an ongoing basis for the rest of your life.
It's not a cure. It's
not a cure. It's controlling the apnea. It's preventing the apnea while you're actually using the device. Okay. So although it works well, one has to understand that it's only working if you're using it. Okay. And it's not going to work the next night if you haven't, because you used it the day before. Okay. So one needs to have an ENT, ear, nose, and throat assessment, and then on assessment, firstly we take a history to make a clinical diagnosis of sleep apnea. Usually it's witnessed, it's patients who are snoring, but you can have snoring or sleep apnea without snoring. But it is usually patients that are snoring. The sleeping partner, witnesses these episodes where the patient stops breathing or wakes up with a gasp or a choke. Okay, and then often we take the history of other symptoms of daytime tiredness in particular. Okay. There are scoring systems called the Epworth Sleepiness Score and things which are look at all these different features, and we can sort of clinically grade how severe the sleep apnea is. Right. So after a history, we examine the patient. Okay. So we look in the nose, in the mouth, in the throat. Okay. And part of that examination, we use often we will use a little telescope called an endoscope into the nose, so we can examine the back of the nose, the adenoid area, the palate area, and the lower parts of the throat that you can't see just with the naked eye, right? So that examination is a fairly quick routine examination, and that gives us a lot of information about where the site of obstruction is, right? The nose, the palate, the tonsil, the tongue. These are the areas we're really looking at. And then once we've done that, okay, and we suspect that a patient has or clinically a patient has obstructive sleep apnea, then we want to do a sleep study. Okay, and this gives us a couple of advantages. One, it grades how severe the sleep apnea is, and that sort of guides you as well in the treatment, whether it's mild, moderate, or severe. Different things would work differently in this sort of in these different categories. But also, if a patient is going to end up needing CPAP therapy, it's a guide to when CPAP may be helpful, and it's also a requirement by the funders, the medical aids, to have proof of sleep apnea so that they can then fund the treatment in the form of a CPAP machine if that's required. Okay.
So this is some sort of objective evidence.
Correct. Yes. Okay. And so a sleep study, there's various ways to do it, but for obstructive sleep apnea, it's actually a very simple study. You've got to monitor very few parameters. It's not like a full sleep study that's required in a sleep lab. Okay, we actually prefer now to do the simple study, and we prefer to do it as a home-based study because the patient does it in their own home, in their own environment, in their own bed. So the quality of sleep is more natural than if they're then being in a sleep laboratory or even in a hospital bed. Okay, where they are uncomfortable, may have difficulty falling asleep or wake up often for other reasons. Okay, so we prefer a home-based sleep study, and that entails a simple device which either the patient is shown how to connect up, or even a sleep technician will come out to the home, set up the device, get the device back the next morning, download the information, and then we analyze it. And then depending on what that shows, if we feel that CPAP therapy is going to be is a good option for this patient, then we would do another study the following night or on another night called a CPAP titration, where we test the patient out with the actual CPAP machine. And then that gives us the figures to show that the sleep apnea is now controlled. And then there's our evidence to submit to the medical aids and apply for funding for a CPAP machine. Okay.
It's tested out before it's presented. That's quite nice.
Yeah. And the patient, also maybe even more importantly, the patient gets to experience what CPAP is like. Is it something that they can use? Is it something they can sleep with, they can manage with, they're comfortable with? Has it had an effect on them the next day? They feel like they have a good quality sleep. They feel fresh in the morning, like they, rather than a tired feeling when they wake up in the morning. Wake up without a headache. Often we didn't discuss headaches, but headaches is when you wake up after with sleep apnea. Headaches it's a very common finding, to wake up with a headache, to wake up with a dry mouth because you're obstructed, your mouth breathing. So these are common things. So by doing the CPAP titration, the patients actually see what the benefit of it is, and then they are more they have a more positive feeling towards using it.
So if a specific site of obstruction is identified, let's say the nose or the throat, what are some of the surgical options that exist? Can you give us some examples of?
So the common surgery. So when we're dealing with from the surgical side, okay, we try and deal with all the potential sites of obstruction. Okay, so often in the nose we're dealing with the septum and the turbinates, right? We would look at straightening a deviated septum and reducing the size of the turbinates, and that maximizes the airflow. Okay. And these are common findings, a deviated septum and large turbinates. So that's how we address the nasal obstruction. In the back of the mouth area, we're looking at the tonsil, the palate, and the base of the tongue. Okay. So if you've got large tonsils, we would look at removing the tonsils. But a large part of surgery for sleep apnea is to the palate. Okay, the palate is often, it's bulky, it's floppy, the uvula is quite long. That's where you have this floppiness, causes a lot of vibration and snoring, but also tends to collapse and block off the back of the nose. So there's surgery to the palate. And then the base of the tongue, if you've got a very large back of tongue, the base of tongue that's collapsing, there are surgical techniques to reduce the size of the base of the tongue. Okay. And this is all done either from inside the nose or through the mouth. Okay, there's no external surgery that's commonly used. Yes, there are external surgical options. Those are in the very, very severe cases that are refractory to all other treatments. Then there are bigger options, bigger surgical options, but that's very few cases.
And for Doctor, for our listeners who may have been suffering in silence for years, assuming nothing could have been done about their airway, about their snoring, about their sleep apnea, what message do you have for them today?
Well, the main thing is to have it assessed. Okay, it's to, you get to an ENT specialist, or somebody that frequently deals with sleep apnea. And have it assessed, have it looked at, have an examination, get a sleep study done, because certainly there are lots of treatment options available that are effective, and one has to try and prevent the consequences of this. So it's never too late. It's never too late. Okay, you rather have it assessed, have it treated, and prevent the progression of disease and the sequelae.
Better sleep, more productivity, a better life. So I think thank you for that, Dr. Thandar. That was an incredibly enlightening discussion. It's clear that sleep apnea is not just about a restless night. It's about the airway itself and understanding exactly where the problem lies, and how do we open the door to real targeted treatment for those areas. So thank you for joining us on this show tonight.
Thank you very much. I appreciate it.
Jazakallah. Unfortunately, that brings us to the end of tonight's show. Heartfelt thank you to Dr. Mohammed Thandar for joining us this evening, sharing his expertise on sleep apnea and its consequences with us. To our listeners, quality sleep is the foundation of good health, so don't dismiss the snoring, don't ignore the blocked nose, don't delay getting your airway properly assessed. Remember, early diagnosis and the right treatment can protect your heart, your mind, and your relationships. Catch us again next week on The Medical Files, brought to you by the IMA, as we continue bringing you health topics that matter. I'm Dr. Zakaria Ahmed Ismail. This was Medical Files. Until next time, take care of yourselves and each other.
An informative Islamic global perspective.